Yeah, so what typically happens is among some of those diagnostic eye drops that we instill, and when I say diagnostic eye drops, um, topical installations that are ocular, some of them are epinephrine, atropine, tropicamide, pilocarpine, okay, and cyclopentolate as well. So these are the few that I can mention. Yeah. So just few among them, like two, are direct acting. The rest are indirect acting. So for instance, the ones that are direct acting among them are just pilocarpine and epinephrine. Yeah, topical installations. So this one is the pilocarpine is a parasymptomatic drug, while the while the epinephrine is symptomatic in nature. So how they act is basically, you know, in the iris, yeah, in the muscles of the iris, you've got the dilator pupillae that is responsible when stimulated and it contracts, that is responsible for mydriasis, that is pupillary dilatation. And then you have the sphincter pupillae that when stimulated, and then it constricts and then leads to meiosis, pupillary constriction. Now the receptors of each of these muscles of the iris. Now, in particular, the receptors that are at the synapse of this sphincter pupillae. Now, when pilocarpine is instilled, pilocarpine directly goes there and binds to the receptor of this sphincter pupillae and activates it. And when it is activated, it automatically leads to the contraction of the sphincter pupillae muscle, thereby leading to meiosis. And then the other one that is direct acting as well is epinephrine. So epinephrine, when instilled, it directly goes to the receptors of the dilator pupillae and then stimulates the dilator pupillae muscle to contract. Then when it contracts, then it leads to pupillary dilatation. Yeah, so the sphincter pupillae muscles are circular, while the dilator pupillae muscles are basically, say, radial. You could just term them to be radial. Yeah. So now the other eye drops, such as atropine, cyclopentolate, and then tropicamide. This is how they indirectly act. When instilled, yeah, they are sympatho. They work on the they are sympathomimetic, yeah, but the sympathomimetic action that they carry out is where parasympatholysis parasympatholysis. What I mean is that if tropicamide, for example, is instilled, yeah, so it goes directly to act on the receptors of the receptors of the sphincter pupillae and blocks it. Then when it blocks it, then the dilator pupillae automatically gets contracts, leading to mydriasis. Now, the stimulation that the dilator pupillae and the sphincter pupillae receive from the autonomic nervous system via the parasympathetic to the sphincter pupillae and the sympathetic to the dilator pupillae are said to be in equilibrium. The suppression of one will automatically lead to the activation of the other. Yeah. So that is the basis of this direct acting. This tropicamide, atropine, and cyclopentolate, they are indirect acting. They directly go to block the receptors of sphincter pupillae. Now, when they are blocked, automatically then the dilator pupillae muscle gets activated and it contracts. Yeah. So the sphincter muscle of the iris are circular, while that of the dilator pupillae can be said to be radial. They radiate from the center. They are radial. Yeah. They radiate from the pupil and towards the base. Yeah. Towards the base of the iris. Okay. So that is how they act. Now these ones are direct acting, while the other one are indirect acting. So so we could say that those atropine, tropicamide and cyclopentolate, we could say that they are parasympathetic. Parasympathetic because they oppose the action of the parasympathetic nervous system or the parasympathetic receptors that are at the base of the sphincter pupillae. Now, it has implication. Now, as a clinician, you want to carry out dilation, and I see you instilling tropicamide, and then you now instilled cyclopentolate again. It will make me question your clinical sanity or clinical judgment, because both of those drugs are parasympathetic. They do not reinforce. There is no synergism among them. It's just a waste of medication. Yeah, it's just a waste that could even lead to corneal toxicity. Okay, so but if you combine epinephrine eye drop with tropicamide or with atropine or with any of those, okay, with cyclopentolate precisely, or let's just say because when you use epinephrine, definitely it has to be that you want an enhanced dilation, so you can be able to possibly carry out your surgery or your fundoscopy. Yeah, so epinephrine goes along with tropicamide to reinforce the action for a synergistic action, because they act on different receptors. The epinephrine will act on the dilator pupillae receptors, yeah, while the tropicamide will go and act on the receptors of the sphincter pupillae to block the receptors there of the sphincter pupillae. So that is just it in a nutshell.